According to the Centers for Disease Control and Prevention, obesity has become a national epidemic in the United States. And for those who are morbidly obese and have obesity-related conditions, such as diabetes or heart disease, bariatric surgery may be the only option that provides long-term weight loss. With me today on Missouri Medical Focus is Dr. Kevin Suttmoeller, an assistant professor of medicine and surgery at the University of Missouri School of Medicine and an internist with MU Healthcare's Missouri Bariatric Services. Dr. Suttmoeller, what is an internist and what is it that you do here within the program?
I've been trained in general internal medicine. Several years ago, I was taking care of patients that had diabetes and found out that by assisting patients with weight loss through bariatric surgery, that I could put their diabetes into remission. So working with some of the surgeons, I'm able to help my patients get long-lasting relief from some diseases such as diabetes, sleep apnea, heart disease, and high blood pressure.
What is bariatric surgery? I understand there's more than just one type of procedure.
Bariatric surgery is kind of a term that describes any surgical intervention where the end result is weight loss. The first surgery is called the Roux-en-Y divided gastric bypass. This is a surgery where you take the stomach and make it into a small pouch about the size of your fist, and we bypass approximately 1 meter of small intestines. A newer surgery is called the vertical sleeve gastrectomy. This is a restricted procedure where you make the stomach into a long sleeve and take away about 2/3 to 3/4 of the stomach. The last surgery is called the Laparoscopic adjustable gastric band, which you may have seen commercials on television for. This is a restrictive band that goes around the top portion of the stomach that makes a pouch where you eat, and it makes you feel full much quicker, resulting in weight loss.
What's the criteria for someone to have one of these procedures?
In 1991, the National Institute of Health basically had a meeting and discussed bariatric surgery, and they wanted to put down criteria to make it safe. And they determined that anybody with a body mass index, which is a calculation to determine basically the amount of obesity, above 35 with comorbid conditions such as diabetes, sleep apnea, hypertension, and heart disease qualified you for surgery, or if you had a body mass index over 40. This qualified you regardless of your comorbid conditions. There are some insurance companies that add osteoarthritis or some other symptoms. And most recently, in the past couple of years, the laparoscopic adjustable gastric band, the LAP band, is also met a criteria if you have a body mass index over 30 now and have diabetes, you can actually get a LAP band.
What are some of those conditions that actually can be either alleviated or even reversed once a surgery like this is done?
Somebody has had diabetes under 5 years. Right now, numbers look like with the gastric bypass, there's about a 92% chance they can be in remission, if they've had it less than 5 years.
And that's a specific type of diabetes?
That's a specific type of diabetes, type 2 diabetes. Type 1 is a different type of diabetes, and that is not reversed by bariatric surgery. Even the LAP band has up to 40% remission of diabetes. Other problems like hypertension, about 75% remission or improvement in hypertension. Coronary artery disease gets better. High triglycerides, about 98% chance it's going to improve with that. Problems like daily headaches from pseudotumor cerebri, dramatic improvement. Carpal tunnel syndrome improves. Chronic back pain, chronic knee pain seems to improve. There's actually decreased risk for some cancers found with bariatric surgery. Reflux disease seems to markedly improve by decreasing that abdominal pressure. A lot of times fertility problems for females, they've been told that they've been overweight and that's the reason they can't get pregnant. That's actually one thing we have to really stringently tell our patients. You have to have some sort of birth control in that first year after surgery, because somebody who's never been able to get pregnant, once they experience weight loss, pregnancy seems to be much, much easier.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and our discussion is about bariatric surgery. Dr. Suttmoeller, can you kind of describe the evaluation process and then the follow-up care afterwards?
Patients come in for an initial evaluation by myself. I do a complete and thorough medical evaluation. Most of our patients have to have a psychological evaluation. It's a requirement of insurance companies. You get some baseline labs. Depending on underlying health conditions, you may have other testing such as stress testing, pulmonary testing, sleep studies, etc. But these aren't required for everybody depending on what's going on with your health. So your care is really individualized. Once we walk you through that and feel that you're a good candidate for surgery, we also try to make sure that we meet your insurance guidelines, which each insurance company has different guidelines. Then you meet with our surgeons, and we have an extensive educational service with the surgeons. You come in for your day of surgery, meet with anesthesiology, you have your surgery. Amazingly enough, the surgical stay for the gastric bypass is 3 days, 2 nights. For the sleeve, 2 days, 1 night, and a lot of times the laparoscopic adjustable gastric band is in and out or overnight at most. University of Missouri is a laparoscopic only center, and we have some of the most talented surgeons really in the United States that perform here at Missouri Bariatrics.
How rapid is the weight loss once someone's had one of these procedures? Is it pretty dramatic?
It is very dramatic. Usually most of the weight loss occurs with the gastric bypass and the vertical sleeve gastrectomy in the first 6 to 8 months, but it occurs over the first year and can actually occur for up to 24 months. The laparoscopic adjustable gastric band can take up to 3 years to get its maximum weight loss. It's a lot slower and steadier weight.
What's the number one question that you get from your patients?
When can I have surgery?
And how long does it take? From the time they meet with you the first time to when they have the surgery?
It really depends on the insurance company. The rate-limiting steps for our patients is getting the diagnostic studies, psychological evaluation, and then getting the pre-authorization from an insurance company. You usually get a psychological evaluation. It can take 1 to 4 weeks to get that in. And then, like I said, once we send it into an insurance provider, it takes about 4 weeks to hear something back. We actually schedule relatively quickly here. Our wait time, everybody says, well, how long is your wait time? Our wait time's not the issue. It's getting it through insurance is always the issue.
If someone wanted to make an appointment or had questions for you, is there a number they could call?
The office at Missouri Bariatrics is 882-5673. Also 882-LOSE.
So it's 573-882-5673. I'd like to thank Dr. Suttmoeller for being my guest. From Missouri Medical Focus, I'm Jeff Helsher.